So I work with people who present with a learning disability and require a learning disability specialist healthcare. As an occupational therapist, I'm working with people to maintain and promote their health and well-being. At university, I learned much more about the role of occupational therapy supporting adults with learning disabilities. When I finished university, I did go on to do a rotation in an acute physical health setting. And there I really refined my core OT skills and learnt so much about assessment and occupational therapy intervention. And when I'd finished that rotation, I did then look into jobs in learning disability occupational therapy and in my current role now, and I've been there for around 4 years. Throughout the occupational therapy process, we consider how we're adapting our practice to involve the person in that process as much as able. So that might look like how we adapt our communication. We might use Makaton signing, talking maps, or other communication resources, and also spending time building that therapeutic rapport to find out what's important to the person. We may visit them at home and spend time in their daily routine in order to get a feel for what they would like to work on and what's meaningful in their life. There's also benefits of occupational therapy to the wider organisation. So in our occupational therapy learning disability team and in our wider community learning disability team, we are there to support other services that aren't learning disability specific, make reasonable adjustments to enable people with a learning disability to access their services. In my role, I work alongside other professionals. I work with speech and language therapists, physiotherapists, and learning disability specialist nurses. We work jointly to meet the needs of the person that we're working with. So an example of that might be working with the speech and language therapy team. So we work jointly so that the person has the best outcome and one set of guidelines and recommendations to follow, rather than having to follow an OT set of guidelines and a speech and language therapy guidelines, so it makes it much more usable. I have quite a lot of autonomy to manage my caseload, which is really helpful because I can meet with the person I'm working with when it's the most appropriate time for them, and appropriate in terms of their daily routine and what their goal is. So if somebody would like to work on being able to travel more independently to their workplace, then I will make sure that I do that appointment during their daily commute and we do that together as part of the intervention. Or if someone would like to work on developing their cooking skills, then I'll make sure that my appointment is around lunchtime. So having that autonomy means that I can meet the needs of the person I'm working with best. My day usually consists of both face-to-face work with the people I'm supporting, but also liaison and training with support networks and other agencies. And my day usually also consists of working with the multidisciplinary team to plan and consider the support that we're providing to the people that we're working with. I think that working as a learning disability occupational therapist is a great role in terms of you really do get to work with the person on the things that are meaningful to them. And we do have a really important role to play in supporting people's physical and mental health. I think I just want to encourage anyone who's looking at a healthcare career to look at occupational therapy, and anyone who's already an occupational therapist to think about working in a learning disability specialist service, because your occupational therapy skills will be really valuable.